Ocean Mental Health provides 2 on-site social workers, and we take direct referrals from the officers, from the dispatchers, for any residents in the community that they encounter through either they call into dispatch or the officers, respond out to the community to assist them. And if they feel like there's some type of unmet need going on, whether it's mental health related, substance abuse, or medical, just any type of social service need that they may have going on, the officers then refer them to our program so we can step in, meet with them, find out what's going on, and see what we can link them to.
Initially, I was interested in the program because I had the idea that it would probably save the officers a great deal of time, that would free them up to do other things, other duties and responsibilities that they had. And then when you marry together the fact that we'd be able to help people and reduce the unmet needs of the community, it just seemed like a perfect fit.
It gives us, I guess for lack of a better word, it gives us an outlet. It gives us someone to, go to ourselves as far as to if we deal with the situation. On Point has been real good as far as we're able to contact them and say, hey, this is the situation we have. I know when it first started I had questions, and even now I have questions as to, does this really fall under your realm or can you help? And again, it's a good sounding board, knowing that they're in our station during the week on different days, and again, being able to reach out to them. You deal with a situation and you could say, hey, that's a good referral to make to On Point. These people could, that we're dealing with could, I think benefit from the use of that. In a sense, I would say takes kind of a weight off our shoulders a little bit. It helps us, solve some of the problems that we might not be able to take care of right then and there, or that would take a period of time, or contacting different agencies trying to figure out, okay, do you handle this? Do you handle this? And like I said, it's just a good resource.
You consider what our officers do, and they are at the front end of so many crises in our community, and many of those, they're not a moment that they can walk away from. It's an issue that is ongoing. It can be addiction or homelessness or any number of kinds of crises that need ongoing help. And now to pair them up with social workers that can help with those ongoing needs, I've spoken to some officers in Stafford, and they are thrilled about it. It gives them a feeling like they can really help people. It takes a burden off of them that they can then move on to other immediate needs. And so it's so good in so many ways.
When I came into law enforcement 30 years ago, I always, when I speak to social service groups, we would never talk to each other. They had one mission, we had another mission as law enforcement, and they didn't like us and we didn't like them. And it came to realize over the years that, hey, we're kind of providing the same services, we're dealing with the same population, the same consumers, and it made sense to start to collaborate and work together.
We really are on the front line, so if it's happening on the news, it's happening in our lives, in every day in our jobs. So, sometimes things take their time trickling down to certain different parts of the society, but us on the front line there, we deal with stuff as it's developing, and a lot of times you're put in a situation where you have to make decisions that haven't been made before, so it is kind of challenging.
So I feel a program like On Point is so important because it gives a different perspective. It, I think, helps law enforcement officers really learn what people in crisis go through, that it might not be that they're misbehaving, so to speak, they just might be having an episode. They might not be looking to break any laws or, do something regrettable. But I also think it helps from the standpoint of it can give the police perspective to the therapist or the worker, the mental health there, who's working to really share experiences and to come up with something that meshes really well for both sides, because I think it's important to keep officers safe, and I also think it's important to expand understanding.
We have shown a tremendous decrease in the police having to respond to the same community members once we've become involved, which was a big goal of the program, the idea being that police can respond over and over and over again. So the goal of our program is to get in there and really figure out why did the crisis happen in the first place, or the need for a police response happen in the first place, and what can we do to stabilize the situation so that hopefully it isn't a police matter in the future. So our numbers are showing very good response, that us getting in there, getting involved, is reducing the amount of time that then the officers have to respond for a crisis or a problem for that community person.
I have stories, real life stories that they'll tell me. I talked to an officer a few days ago that was encountering a couple that was hanging around in a parking lot of a store, and they were called in because somebody was worried about why they were hanging around, and it turns out that they lost their home. And their children were living with relatives, but there was no place for them to go. And so he referred them, and they now are actually moving into a home together as a family. It's life-changing, parents and children together again. And and there's dozens and dozens of other stories. I think since the pilot started, they're now closing in on 100 actual referrals. Every one of those is a story and a life. After my last conversation with one of the officers in Stafford, I started thinking about federal funding sources. There are federal grants for all kinds of law enforcement programs, from bulletproof vests to training for officers, to providing Narcan. I want to see this pilot completed, but I think this is an opportunity for maybe both the state and the federal government to get involved and to help police officers with their increasingly complex job.